So for this issue, currently my family is dealing with this. My grandmother's health is declining and she has been diagnosed with early onset dementia. Due to her health decline, we've had to put her in a facility that watches over her. When factoring in where she would be living and residing in, we heavily depended on my aunt who works in the healthcare industry. She is an occupational therapist, so she knows the ins and outs of what would be good for her. Well, she also travels too, so she sees this every day. And she's worked with, or the home we put my grandmother in, she's worked with the caregivers and the people who watch over her. She's trained them as well, so she knew exactly who to give her to and who would make my grandmother comfortable. My aunt also knows all the best doctors, and she is in that field as well. We decided to move my grandmother into a home that has fewer people. I mean, it's technically not a nursing home. It is run by like a family and they watch over her. But we just wanted to give her more of a comfort feeling where it's only a couple of older people who live together. And they have just a couple caregivers to watch over her versus in a nursing home where there's like hundreds of patients where there's not really personal connections and all of that. The steps we took to ensure that my grandmother would be well taken care of is that we looked at reviews from multiple places. We researched online to see what people thought. Word of mouth by other families who had other family members living under the facilities. We looked at the ratings online. We even went and asked doctors about their opinion because, you know, they would know what is best and what's not. And we also toured the facility, and we had my grandmother living in a facility before we found the permanent one for her, and she was able to tell us if she didn't like it or if there are certain things she didn't like, and she did, so we eventually moved her out of it and found her a better place. The people that were included on the decision where my grandmother was placed was all of her children, her biological children and their spouses, her stepchildren and their spouses, and her brother and his spouse. We knew the facility was safe for my grandmother because luckily, like I said, my aunt worked with the family before and they were watching over her, and we were just lucky that my aunt does work in the health field and she does deal with this every day. I realize not a lot of people have that privilege, and I'm just really grateful that we were able to get somebody to watch my grandma and she's safe and healthy. Some key elements that we would require the facility to have would be that first of all, the facility is licensed by the state. It has an A rating on the Better Business Bureau. My grandma would be able to have her privacy, and that the facility would really prioritize her being clean. I know it's not like a big deal, but some facilities ignore that aspect, and I don't like that at all. So we had to make sure that she's getting cleaned up and getting baths daily. The facility would also have to accommodate to visitors, since we love to go visit my grandma all the time, and she likes that too. It helps keep her morale up. The facility itself would have to be neat and clean. We don't want it to be like dirty. That was a big factor into that as well. And the facility would have to have good medical equipment. I myself work in a medical field, so I know that the quality of your instruments is a really big deal as well. And then my grandma would still have access to social contact. Like I said, there's other families and people living in that facility, so it's really good that she has that social contact so that she's kept happy. We don't want her to be lonely and sad because that would be depressing. We don't want that for her. And then lastly, that the facility would allow my grandmother to see her regular therapists and doctors when they come in, because my grandmother, it's hard for her to travel. So it would be good for the traveling team to come see her so she can get her regular care and maintained. But yeah, that is everything that we would factor into the health of my grandma. And I mean, there's more to it, but that is just the answers to these questions.